welcome everyone to a special Mini for Change lecture, number 44. It's December. What do we do in December? We freak out because we have all these relatives and things to do, and it never ends. No, we actually have a fun lecture today to kind of depart from the usual kind of focus on weight, maybe, but looking at our health and wellness in a different way. And Dr. Megan Nadeau is one of our plastic surgeons here, is just awesome, and she has a very fun slideshow and talk to give to you. But first, as always, I have a few little parting thoughts for the end of this year that have nothing to do with the election, by the way. Woo! So, beauty is in the eye of the beholder, right? Kind of means different things to different people. Sometimes we don't feel beautiful. Sometimes we have to try really hard to be beautiful. I cannot believe I'm showing that. This is the after. And sometimes we just like go all out and say, I don't care. But moving on. Sometimes we just, we have to pamper our spirit and our soul and feel like, what we put out to the world really has meaning and value to us. So, animals have it easy. But isn't that cute? Gosh, no makeup. The grand paradise of nature around us is just stunning, and I think sometimes we can learn tips from that. The very old, the very young, some of them have been departed. There's beauty in everything, in every face, whether it's wrinkled or not wrinkled. And I think that's kind of something to celebrate. In art, you can celebrate that certainly in many famous paintings. Kind of takes you back, maybe we're living in the wrong century, People had a different image of what beauty and inner spirit and how the face was. And she's kind of rocking it. I think it's the hair, maybe. So, the form of the human body, curves and lines that were beautiful, and things have changed. But I think, again, what do we bring to ourselves, and what do we feel happy about? I love this Picasso. Oh, it's gorgeous. It's gorgeous. You can see so many different forms in there. The faces are very unique. And, we need to just relax, repose in nature, enjoy that kind of image that we create for ourselves, and find joy in the beauty of the form and the beauty of the face. So I just want to whimsically transition to Dr. Nadeau, have you follow that discussion. So we're going to take a pause and set things up, so stay tuned.
So after that lovely introduction, let's talk about facial aging. So yeah, this is not a face, this is a building. I like to think of the face in particular as a whole, right? And the thing that you start with is the foundation. The same for any building. And then you add scaffolding. And then you put a veneer on, right? The outside of the building. And all of those things affect the final product. The same is true for your face. The foundation is your bones, and as you age, they actually do resorb a bit, changing your facial architecture. Then you add muscles and fat pads, and those are kind of the filling, which you're filling everything in with. And the position of these changes with age, and that's part of your architecture. And the actual volume depletes with age, right? And that's kind of that middle layer of thinking about facial aging. And then, of course, it's covered in skin. And I like to think of facial aging in all of those different components, because your problem or whatever's bothering you may be addressed in a number of ways. It may be addressed with surgery. Those are typically architectural type changes. So positioning of things, smoothing the jawline. It may be that you've lost volume and that we can just add filler using, essentially non-invasive techniques to help you out. And then, of course, the covering the skin. When you change the skin, the texture, the color, age spots, those things, fine lines, they really give you a refreshed appearance even if you do nothing to the architecture and volume. So what am I talking about? What affects your aging? So this is actually a lovely example. The daughter is age 26 and mom is 64, and obviously they have a very similar face, and so you can see this aging process in mother-daughter combinations. we talk about the triangle of youth. What that means is that your jawline is tight and that most of the volume in your face is in the upper portion of your face, in your cheeks. Your temples are nice and full, your eyelids and brows are in a good position, and as gravity, sun damage, weight changes affect us, we start to get the inverse of that triangle. And so everything starts to fall down and sort of melt off the face, right? And that's what you see here. She has these thickening of her nasolabial folds here. Her jawline is not as crisp as her daughter's, and her volume is concentrated in the lower portion of her face rather than in the upper portion of her face. So here we can see them side by side. One of the first things that starts to change and show aging is actually the skin, rather than the volume and the underlying architecture. And we see those in fine lines. We see them particularly in color of the skin. So you start to see some permanent freckles that come up and maybe are a little bit larger. So we lose the ability over time to tightly regulate the pigment in the skin. So the melanocytes are just not as good at controlling that evenness of tone. You also notice that your skin often becomes drier as you age. And that contributes to fine lines. It also contributes to that kind of fresh-faced look. So we combat that with skincare, teaching the sebum-producing cells to regulate themselves again, exfoliating properly so that you have that kind of dewy, fresh look that we associate with youth and makeup. So how do we do that? Currently, this is my favorite skin line, Zeo Skin Health. I like it because they essentially have something for everyone. No matter how young, how old, what your particular issues are. You can get on a very customized regimen that does in fact make a difference. So I will show you just some, this is skincare only photos, okay? So this is before and after 4 months. She was on an aggressive hydroquinone-based treatment, and then she had a series of light peels. So light peel, what do I mean by that? I mean 3 to 5 days of downtime, flaking, redness, a little bit of irritation, and really that's it. So she had, I think, 3 light peels, and that's her difference. And that's with no injectables, no surgery, just skincare. It takes a little bit longer to see results from skincare. You need 1 to 2 skin cycles, so you have to be a little bit patient. But usually it's around that 4 to 6 week mark, and it's probably a lot like weight loss, right? You start to make all these changes, and unfortunately we live in this instant gratification society, and we're not really conditioned to wait that time period. But usually around the 6 week mark, people start to notice and say, "Oh, you look rested. You look really good. What are you doing differently?" And usually you change your skincare, add a retin-A. Yeah.
Is there a difference between, Asian, Hispanic, African American, Caucasian, in terms of that type of success or these kind of results, or is that a factor in how these regimens are made up?
It's a factor in terms of what you do with light-based therapy to treat them. For skincare in particular, those regimens actually work well across all skin types. That's part of why it's so nice to see these things, because they're safe to use in darker skin types. When we start talking about light energy, laser therapy, those are times when you're more concerned about darker pigments. You have a higher rate of depigmentation or hyperpigmentation, post-inflammatory hyperpigmentation, things that can happen with light-based therapies in those darker skin types. So if you can get them to respond to skincare and peels, which are perfectly safe, it's nice, but anybody will respond to this. Yeah. So safe in all skin types. Although the regimen may change, right? And that's dependent, it's very individual, right? Your skin is not the same as your skin, is not the same as my skin, and so you have to go through those things and talk about each kind of issue and deal with those things. And then personally, I tweak my skin regimen somewhat obsessively. So I'm not really a good example for that, because I'm mostly on this, but then, I'm sometimes on that or the other thing, or,
We're female.
Right? Yeah, plus, this is my job, so I have like a whole 2 drawers full of stuff. So some days I think, I think I'll put a little of this, but this again is skincare and a series of peels. And then this is actually just skincare, no peels whatsoever. And that's her 4-month result. So this is the anti-aging kit, kit 3, which a lot of times is what I'll start people with because it's just nice. You get to try a number of products. It's a good price point when they're packaged that way. It's just a little bit more reasonable. But if you were going to do anything from my lecture today, I would say start a retin-A. And all the time I hear, I can't tolerate it, or I'm allergic to it, and everybody gets red, everybody peels with retin-A. Some people are more tolerant of that, some people are less. So it's very important how you start that treatment. So you want to mix it with a moisturizer, you want to start several times a week, and then slowly build up. And your skin will get used to it, and you'll start to see effects on your fine lines. You will increase your cellular turnover so that your skin appears brighter. And as a bonus, you are actually decreasing your skin cancer risk. So then the next layer is the muscle movement of the face. So we start to see fine lines, right? What are those due to? They can be accentuated by dehydration, they can be sun damage. Also, the muscles in your face are meant to express your emotions. Over time, you continue to make those expressions and lines that, any person can make a line in their face by moving their face, right? But over time, we continue to make those movements, and then when we stop making the face, the line stays. So what do we do about that? That's typically treated with Botox, so local small injections of nerve toxin to relax the muscles and relax then the wrinkles as well. My particular practice, I tend to do minimal injections and a very natural look. I like to preserve some movement. You can see I'm moving my face, right? I can still make expressions. I don't look like a mask. But I use Botox to reduce those so that I don't have fine lines and wrinkles. So I think that's an important thing, particularly as these things gain popularity. The times that you see them are typically times when they're not done well, right? Because that's when you notice. So I have a lot of patients that come to my office and they're terrified of filler or terrified of Botox, and it's because if it's done well, you don't notice that anybody had it. If it's done poorly, everybody knows that you had it, right? So this is treating her, what we call this area, the glabella and the forehead, as well as her brow. So you can get a little bit of a brow lift from Botox. So you notice her eyes here appear much more open, and that's because this brow position is corrected. We do that by actually relaxing the muscle that closes down the eye, and so then we get the reverse effect, which is to open the eye. So here, this is prior to treatment. She's making kind of an angry face, and here she's trying to make that face, but she can't quite get there. So the first time I ever tried Botox was in residency. It was because everybody thought I was mad all the time. I probably was mad all the time. So then I finally just Botoxed my forehead, so at least if I didn't say anything, nobody knew I was mad.
My teenage daughter has a word for that. They call it resting bitch face.
Yeah, exactly. That's right. That's right.
I said, what?
And we'll talk about that too. So that's a whole different kind of, as you age, a lot of people come to me and they say that, or they say, everybody thinks I'm angry, or they think I'm sad. And we'll talk about that when we talk about perioral aging particularly. So here, these are laugh lines, and then here's after Botox. So you can see she's smiling, but she's not making those lines. And I forgot to tell you too, her brow, see, is a little bit higher there. So in a female, the ideal brow position, if you kind of just feel your brow, is the medial part of the brow is below the brow bone, okay? And then it starts to arch up about 2/3 of the way here. And that should actually be at or slightly above the brow bone. This is one of the first things actually to start flattening out over time. And like I said, if it's not dramatic, we can actually just fix it with Botox, which is nice. If it is dramatic, then we fix it with surgery. So this woman, what's she dealing with? She's dealing with skin texture issues, she's dealing with laxity, she's dealing with her facial architecture not being the same as it was. She has a lot of sun damage, and she was a smoker. So you can see her lines are well etched. You can see this changing her skin, right? And then you see these lines, and these are so etched in. Why is that? I'll tell you why. She is lifting her brows so that she can see. So her brows have descended to the point where she actually cannot, this is asking her to relax, she cannot relax her forehead because her body has told her, lift your forehead so you can see. And so over time it gets the message loud and clear, and she makes these very deep lines here to keep her brows and her upper lids out of her actual eyes, which you can see particularly while driving. And so what did I do for her? I actually Botoxed her forehead so that she could relax it. I sent her to ophthalmology and let her have some visual fields. And then her insurance actually paid to lift her brows out of her eyes. So this is her 10 days post-operatively. So I've actually gone in endoscopically, so through tiny incisions in the scalp about this big, and lifted her brow and fixated it. And you can see it's in the same position as the position she's holding it in, but now it's actually there with her forehead relaxed. So you can see there's no lines there. And then I actually also took some, you can see this extra skin here, right, that fold. And so I took the skin out of the upper eyelid and then laser resurfaced her face. So you can see her lines are not gone, but much better. And that's, like I said, just 10 days after surgery, so she still has a little swelling. This gentleman is 4 days after surgery because he's so happy he won't come back and let me take pictures of him. I put this here because, you know, particularly if you've had some, if you've carried some extra weight, you have fat pads in your eyelids as well, and you can, actually your eyelids can get so heavy that they're in your way even if they're not drooping. So he had both problems. He had a lot of extra fat in his eyelid, and then his actual lid position was low. So you can see how you can see the beginning of his iris here, and here you can't really see it. He actually just thought that his cataracts were getting worse. And then he went into his physician, and they said, no, your eyelids are in your way. So actually he woke up right after surgery in the recovery room and said, I can see! I said, well, that was the point. So then moving on to the lower eyelid. The lower eyelid is a bit more complicated in the way that it ages because there's so many things that affect it. One of those things is you can see this becomes longer. So we talk about this lid-cheek junction. And the lower lid skin is actually the most sensitive to aging, to sun damage, all of those things in the entire body because it's the thinnest skin in the body. So when you have repetitive sun damage, which we all do because we live in the world, even if we're careful, that skin is affected first. And that's when you see that crepey under eyelid skin. You start to see a darkness as you can see the vasculature through the skin. And this becomes lengthened. You get some fine lines around the eyes. And then this here, this is on the inside of the eyelid. This is the orbital septum, and it's attached to the tarsal plate, which is the thick structure in the lower lid, and then it's attached to the orbital bone. And what happens is, like everything else, gravity wins over time, right? And so that septum starts to relax while it's attached to bony tight structures in the lid and the cheek, and so it pooches out. And that's where you see that fat pad, which is quite normal in the lower lid, protrudes out. And you start to see that protrude out, and then you start to see this descend. The malar fat pad starts to drop and actually decrease in size. And so you get either the pouch here, and then you get a prominent orbital rim, and which you see as a depression between the lid and the cheek, and then you see the cheek start to fall here. So all of those things combined are what give you a tired appearance. That's usually the thing that people say, I look tired all the time. So what do we do? So this is non-surgical camouflage. She's not an ideal candidate for non-surgical camouflage, but she's 85 and she doesn't want surgery. So this is what's bothering her, right? This trough, which you can see more prominently when she looks up. So I just put a little filler in there. And that's her, I think, a week later. There's surgical correction. So you can see here, she has this depression. It's better, not gone, but better. And the lower lids are more individual than a lot of the things that we do. So that really requires an individual discussion, but there are multiple surgical techniques, and depending on what you have, will change how we fix it. So here you can see, like I was talking about her, she has this lengthening of the lower lid. She has septal laxity, so she has that herniation of the fat pad. And then she has this prominence of the rim. So she's missing fat here, this fat is poking out, and that all makes this dark depression there. And here you can see this is much improved. And she actually would improve further if you supported her cheek, either lifting her mid-cheek surgically or adding a little volume with either filler or fat grafting.
What did you do to her to get that surgery?
Yeah, this is surgery. Yeah, so the incision is inside the lid, which is why you don't see anything outside. Volumization is one of the things that people don't usually think about with facial aging, but really contributes to that aged appearance, particularly in this mid-malar area, this medial cheek or next to the nose. So this fat pad here starts to droop down, and it starts to actually have less volume. Both of those things make the nasolabial fold, this portion of the cheek here, seem more heavy. You can demonstrate this if you push up. Number one, repositioning helps. And the other thing that helps is if you add volume, there's less skin to sag there, making that fold less prominent. So this is a non-surgical result. This is 7, she had I think 3.5 or 4 syringes of Voluma in this picture, and then 7 for the total effect in that picture. So you can see, and this is correcting her cheeks. You don't look at her and think, oh, her cheeks look flat, because we look at ourselves in 2D, right? But you are in fact 3D. And so correcting this fat pad here and also here really gives her a lift here. So she has nothing in her nasolabial fold actually injected directly. She's just had her cheek supported, which brings all of that volume back up and makes this less apparent. And then from here to here, she has a little more in her cheek, but she's also having her perioral area corrected. So around the mouth, this fat pad is often one of the first. So right here and right here are often the first places to lose volume in the face. And what happens? That's where we talk about resting bitch face, right? Because this, we call this the oral commissure, the corner of the mouth, starts to become unsupported. And it hasn't happened to her yet, but the next thing without correction that would happen is she would start to, the side of her mouth would start to go down. And that's the, everybody thinks I'm mad or tired or sad, right? And it's a combination of things, one of which is that this muscle starts to pull a little bit more strongly than the muscles that elevate, so we can add a little Botox and change the corner. The other thing that happens is you start to lose that fat pad, and that doesn't support the mouth as well, so that the neutral position is in fact neutral and not downturned. Do you have a question?
Yeah. How often would she need to repeat this procedure?
So this lasts 12 to 16 months, this particular filler. Fillers, depending on what you use, have different lifespans, so that's a whole discussion in and of itself, what you use where, and most of us are pretty particular about what we use where, depending on whether we want it to be hydrated, whether we want it not to hydrate. So you can imagine you're not going to use the same filler around the mouth as you are under the eyes, right? Under the eyes, they're already prone to swelling. You may notice if you go out for sushi, have soy sauce, you're puffy in the morning, right? So if I use a filler that grabs water, that's a disaster. Right now I've made your eyelids puffier, which is not the intended effect. But around the mouth, it's kind of nice to draw in a little bit of water and get a little extra boost for that same volume.
So are the fillers like synthetic, or are they from other parts of your body, or?
So they can be either.
Okay.
Most of the filler I'm talking about is hyaluronic acid fillers, so they're synthetic and they're dissolvable. They are actually, hyaluronic acid is in the basement membrane of each and every one of your cells. So it's a naturally occurring compound that we make synthetically in the lab and then inject. You can also use fat grafting, so that would be the permanent filler, essentially. So you liposuction an area, and then you use that fat, distill it down, and inject it into the face. And that has obviously a permanent effect. The other thing about fat grafting, I'm wandering a little bit, but it's kind of interesting, is that you, over time, tend to see some improvement in the skin with fat grafting. So if you fat graft here, you know, the under eyelid and the cheek skin improves over the course of 10 years or so, which is a pretty interesting phenomenon. So there's her before and after right next to each other, just so you can see. This is a completely non-surgical result. Again, non-surgical result, this is 2.5 cc's in the cheek, particularly right here. And you can see, this is interesting because she's had nothing done to her eyelids, but you can see the improvement in the appearance of her eyes. And all that's been done is supporting that volume of the cheek. So she still has a little bit of an imprint there, a little bit of a depression, but you can see that her darkness is mostly caused by shadowing. So there are essentially multiple causes of darkness. One of them we talked about is the thinning of the skin and seeing the vasculature. One is actually the shadow. So if you have a little bit of prominence here and no prominence here, then this lower lid shadows down, creating that darkness. This is Juvederm. This is 2.7 cc's, or about 3 syringes of Juvederm. And this was injected into her perioral area and then also into her nasolabial fold. Now this is a nice correction. I tend to be very conservative when I inject the nasolabial fold directly, because if you over-inject it, and this is one of the complaints that people have, is it looks funny. Why does it look funny? Well, your cheek is not supposed to be at the same 3D level as your upper lip. So if you over-inject the upper lip or over-inject the nasolabial fold, you get a little bit of a simian appearance. It's true. Monkeys are flat, humans are not in that area. So we are not trying to look like monkeys. So, and you can see here, she actually could use a little bit of volume in her mid-cheek there, and that would even improve her appearance further. Males, there are no males here, but just in case I put this in. So this is 2 cc's, and again, this is that the aging mouth, right? He looks just kind of a little bit sad, and here this is a pretty good improvement. But he's not overdone, right? He doesn't, you know, look too done. With males, you have to be even more careful because you're not trying to feminize them. Natural looking lip injections, I just put this in because yes, it can be done. Your lips do not have to look like duck lips. You don't have to look like Kylie Jenner. So here, this is actually very little product, and this is one of the areas that starts to be depleted, this mid portion of the lip roll, and it makes the lower lip look like it doesn't have volume. So this is actually just injecting that and nothing actually in the lower lip itself, and then recreating this tubercle. One of my pet peeves with lip injections is people want to volumize, so they put filler here and they put filler here, right? Which is the natural, more prominent portions of your lip. But then they don't put filler here, and you distort the natural architecture of the lip. So she's had filler previously, and you can see this is nice and volumized, this is nice and volumized, but she's flat line across the mid portion of her lip, which is not how anybody's lips start. You know, you have this, right? And the answer to that is that this is supposed to go down and fit into a little depression in the lower lip. So here, that's been corrected. And then moving on down, the double chin. What can we do about the double chin? Well, you can have surgery, liposuction. Now we also have several non-invasive modalities. So this is one series, one treatment of Kybella injections. So just a series of small shots into this area that actually dissolve that submental fat. And this is an area that tends to be very resistant to weight loss. It's one of those just genetic areas. Either you got, you know, the double chin from mom or dad, or you didn't. And this is one treatment, so typically we recommend 2 to 4 treatments, but you can see a pretty nice improvement. And actually it makes her look younger. And it's because she's starting to get this jawline back. It's much crisper. Speaking of the jawline, this patient, so this is a surgical correction of the jawline as well as laser therapy to the skin to improve the age spots and fine lines. And you can see this is quite a bit of skin, and this is not uncommon in weight loss patients, particularly if you lose a lot of weight. This is more kind of what you would expect in the massive weight loss patients, but nonetheless, you know, you put in all this effort and then you have skin that sags because you lose skin elasticity, and then once it's devolumized, the skin is still there and it can't contract back up. This again is looking at the jawline, so you can see here's the extra lines right in her neck, and here it's been corrected and her jawline is much more crisp. This is more obvious in this view. So she's had this obtuse angle, and then there's this extra fold here, and this is really quite a bit of skin. And this is where, you know, it would be nice if this were really, really crisp right here, but this is a nice result. This is a surgical result, and you can see this is 3 months, and this is her scar, so the scar pattern goes just around the ear. It's pretty imperceptible. She has her hair back, and that will actually continue to improve over the next 6 to 12 months. It's where you can't really tell she's had anything done. Combined surgeries, so this is, and this is actually one of my partner's results, but this is brow lifts. You can see her brows are in better position. Her upper eyelids were done, opening her eyes. Her lower eyelids were done, and facelift. So you can see, here's the correction in her jawline and her neck. You can start to see that extra skin, which, so you can see here, and you can see how dramatic it is. So I don't have her side view, but you can imagine that it's pretty dramatic. And then combining modalities, so surgery, laser, fillers, Botox, the difference in results. And this is early post-operative, so it's not completely fair, but we start these modalities pretty early, so you know, it at least gives you some ideas. This is her before. This is after facelift and upper eyelid surgery. And then this is after having a mid-level laser resurfacing, some Botox in her forehead, and filler to these nasolabial folds or princessy lines. And there's her side-by-side before and after. Again, so this is a surgical result, and this is surgical plus non-invasive modalities. So it's a pretty dramatic difference. And this is kind of what I was talking about in the beginning about really correcting the skin and noticing a dramatic difference. So this is, you know, having some additional volume for him. He's quite thin, and that's one of the problems with thinner people. They tend to have more volume loss, and correcting his skin. And you can see his non-invasive result is almost, in this view at least, not from the side, so you can see here, so he's got a lot of extra skin there. But from the frontal view, the non-invasive stuff is actually more dramatic. And here again, so she has a lot of pigmentary problem, or, you know, discoloration, a lot of extra freckling. You can see that a little bit more here. And then here is starting to correct, so this will take time to correct, but that's her early result from laser resurfacing and color treatment. So some people call these lines the crow's feet. It's a plastic surgery joke. I couldn't help it. Does anybody have any questions? Yeah.
You were talking about using, is it retinol?
Mm-hmm.
If you have rosacea, can you use retinol?
Mm-hmm. Safe. Yeah. You may notice a little bit more dramatic kind of redness and peeling as you start it. But you should also, so rosacea over time tends to, you probably already know this if you have rosacea, but tends to continue to worsen over time and can cause some cobblestone changes and other less desirable things. And so typically I recommend a topical treatment for rosacea as well. And there's multiple of those available.
What about vitiligo? Or is that the way to?
Yeah, you're right.
Yeah.
It's fine for vitiligo. Vitiligo is one of the hardest things I think that we have. The best thing I know for it is actually an experimental thing. There's a guy, Rex, he's at MGH actually, and he's working with some, taking actually just epidermal grafts and repigmenting. His results are pretty dramatic. So hopefully that'll be available at some point. But that I wouldn't notice as much of you don't expect a dramatic result because that's not your melanocytes being deregulated, right? You're actually just losing pigment in particular areas, and we don't know what causes it, and therefore we have trouble treating it. Does anybody want to be assessed in front of everyone?
Oh, what the heck, of course.
How do I do this?
Just come up.
Okay.
Can I bring your
Do you want to
bag
sit?
and put it over my head? Actually, I'm sitting here wondering how much of this is covered by insurance and how much I need to use. Yeah.
Yeah, so, and it depends, so it's very person dependent. Most of the things that I do are not covered by insurance, but upper eyelids and brow position can be, depending on essentially how much your lids are getting in your way of your vision, right? Retin-A sometimes is covered by insurance.
I can't see.
Yeah, exactly. So, actually this is sort of a silly anecdote, but I sent my dad for visual fields, so I was like, Dad, really? You gotta get your eyelids done. What are you doing? And so he calls me on the phone and he's like, Megan, they took me in this booth and then they flashed lights in your eyes and then they taped up my eyelids. And I'm like, yeah, Dad, I know how the test works. I sort of do this for a living. He's like, oh, okay. Anyway, yeah, so, right. So that part of having a doctor in the family, they just order something, they don't tell you what to expect. So. Okay, so is there something that bothers you?
Oh, well, yeah, where do we start?
At the beginning.
How much time do you have?
How much time do you have? Really good question.
Well, we can start with the chin.
Mm-hmm.
Yes.
Okay.
We could, but if you have a different place to start where you think is.
Okay, so I'm just going to ask you to remove your glasses.
Okay.
Okay, so now you're starting to do what my patients do, which is pull your lids and your brows up out of your eyes, right? So you're doing that naturally, and I'm trying to relax you. So close your eyes. Okay, now what I want you to do is just try to relax and take a deep breath and slowly open. So do you see that? And now do you see how she naturally picks them up out of her way? So you actually have enough brow, and yours is mostly brow ptosis, that,
Oh, sure.
yeah, that's the technical term. Falling brows.
Can't wait to tell this to my daughter. Brotosis is in your future. But Megan is almost your age and she can fix it.
You know, so if you turn to the side,
Okay, oh dear.
so if you see, when I relax her, do you see how she has this extra fold of skin that then sits over her peripheral vision, right? So that your insurance would pay to correct, right? So her brows are a little bit flat, and we would ideally like them to be like that. And you can see how much difference that makes. So the question is, do we do your brows? Do we do your upper lids? And different people are different in terms of what's getting in their way. For her, it's a little bit her lids, but it's mostly her brows. So if I hold her brow in the appropriate position, she can see.
Wow.
Okay? So that's probably the first thing that I noticed.
And I have to say, Dr. Nadeau, it's very clear to me that Megan is just not.
To be fair, more than means us too.
Yeah. Yeah.
So,
Wow.
and you can see she has a little bit of prominence of this fat pad here. So if we did her upper lids, we would take care of that as well, smoothing that out. Her skin is in good shape. She has just a little bit of redness and some browns that are starting to peak up. So skincare and then some IPL would be really good for that.
IPL being
intense pulse light. So it's, some people call it a laser. It's not technically a laser, but it's actually it's a great treatment. It has essentially no downtime, and your browns get really dark, and then they just flake off. You don't have flaky skin, but they just sort of disappear over time. So the IPL data is really interesting. They did 2 studies that I really like. One is out of Stanford, and they looked at RNA. So, you know, everyone's familiar with DNA, but RNA is actually what the pieces of your DNA that are being used to encode proteins. So they looked at RNA in 20-year-old skin, 50-year-old skin, and then 50-year-old skin treated monthly with IPL for 3 to 6 months. And they noticed the 20-year-olds and the 50-year-olds made totally different proteins in their skin, no surprise. But the 50-year-olds treated repetitively with the IPL started to make those 20-year-old proteins. Pretty amazing. And then there's another study out of Florida, Jason Posner, who he sent photos to physicians and asked them to guess the patient's age. And the physicians were within 2 years, okay? He then treated those patients for, I think, 10 years actually with IPL, and then sent them again, and they were 10 years off.
Wow.
Just IPL. So yeah, it's personally one of my own favorite treatments, but yeah, so that would help with color correction. This would make a dramatic difference for you. Her volume is good. She's starting to lose volume here. You can see the change when I do that in her lower lid and her cheeks, right? So adding a little volume there could be done. She has just the beginning of a little bit of lower lid aging. It's not bad. She has a little bit of crepey skin there, so Retin-A would help there. You could take a little pinch of skin out. You can see the improvement there.
This is
Is this
absolutely,
fun yet?
this is even more, I mean, I thought it would be interesting, but this is like, wow. Wow.
She hasn't gotten to those yet.
I
Wow. Okay.
I know, I actually kind of left that out of this talk. You do get, you know, your nose continues to grow and dip down. And then she's predictably losing some fat here, and that's doing a few things. So relax your mouth. So it's beginning to have her corners turned down, and then it's making this appear heavier, right? And so you can add volume here, which helps, or she's starting to get this little bit where, you know, your face just continues to descend off the jawline, and that's actually what makes
You put it so
it.
Thank you for being so kind. Descend, I'm keeping that word.
That word droop doesn't.
You know, you can only offend people so much when they're honest. So here, and then you have some fullness here, right? Some segmental fullness.
Fullness and descent, my words of the day. Thank you.
So here, you know, you would really doing a little bit of liposuction and lifting this would be the ideal. You can see that.
And I can
Right.
see,
And then
even
you
with my
can-
glasses off, people nodding
Here,
their heads.
yeah.
It's like, wow.
So when you do this, right, then we go ahead and just lift this a bit, that mid cheek.
Wow.
Yeah.
Hold that. That's great. And I'll send it to you.
Okay, thank you.
Here we go. All right, now let go.
It's like before and after.
Mhm.
That's
I'm
incredible.
feeling much, I'm actually feeling much better about aging after this thing. It's like, wow, you know, there's no reason for me to walk around like this if I don't have to, right? Wow, okay.
Personal
What I
choice.
also heard, this is a compliment, is that you have such, you know, there's a lot of great things going on in terms of the tone and the texture. I mean, there's a lot of good protoplasm.
It's true. Yeah, and that's actually, so when you have actually, your skin is nice and thick, it's not thinned out, and that actually gives you a nice lasting result. So, because you don't need a lot of that other work, right? You've taken care of the outside.
And we're all eating better than we were before we started this program, which doesn't
Matters.
hurt either.
It does not hurt.
Right?
Yeah.
Okay.
Getting proper nutrients and all that really supports all of those immune functions, right? It helps. So, you're going to start a retin-A, which is going to increase your cellular turnover, but when you have the appropriate proteins and nutrients, then your DNA repair mechanisms work appropriately, right? So all of those things work together. Another thing that, I tell my patients a lot actually is really work on your protein, particularly post-operatively, because, and it's selfish of me because, I've just made incisions and I need them to heal, right? And so having the appropriate protein is really what's going to help you to heal those incisions, because everything essentially, all your collagen, that's a protein backbone. And so having those proteins is going to make you heal faster. It's also going to decrease your swelling and the fluid in the surgical site, because if you have enough protein in your blood, it holds the fluid inside your vessels rather than letting it leak out into the surrounding tissues.
Okay. Yeah. Thank you so much.
Thank you for volunteering.
Sure.
Yeah.
Want to do one more volunteer?
I have a question.
Sure.
If you're losing weight, should you lose the weight before you
Ideally.
do any work?
Yes.
Okay.
And this is a question that comes up a lot in my office. So if anybody's planning to lose weight, I always ask them to get to where their goal is, or at least where they're stuck and they feel like it's not going to change. Because it's that up and down that really destroys the elasticity of the skin, right? And I can lift it back up, but then if you yo-yo or you continue to lose weight, now it's a moving target, right? So I've lifted you appropriately to make you look nice and natural and not windswept and strange, which I saw a lot of in LA, but I'm sure you can imagine. But if you then continue on your journey to lose weight, then your result is not stable, right? So always better to be at your goal weight and stay there, and then have these other things, filler, Botox, those you can do anytime. But particularly if you're considering making an investment like surgery, you want to be at your goal weight, particularly here. The eyes, that's not going to change a lot with weight, so we can do those anytime. But the jawline, that's going to change with weight. Excellent question.
When you talk about protein, is that something just normally you would say somebody should have plenty of protein for your skin? And what would be the difference if you had an incision or something?
So so if you have an incision, you're using that protein up, right? So it needs to be replaced. You're actually using it to make the collagen to put down the scar tissue. So one of the things that people say post-operatively, even when they're not hurting anymore, is, I'm tired, I'm so tired. And there's different things that contribute to that, but one of them is, sometimes we lose a little blood in surgery, so you may be a little anemic. One thing is that you're using all of that energy to heal the insult that I've created. So the better nutritionally supported you are, the better you feel post-operatively.
How much protein would you suggest, sort of like ballpark?
Well, I look at the numbers in the blood if I'm really worried. So I like those to be normal or high normal, but I don't have like a certain number of grams. I could calculate it for you. If you looked at, so post-surgical, right, you've increased your metabolic rate and your utilization of protein. So I actually could figure out those numbers, but I haven't sat down and done the math. Anything else?
I'm just curious about cosmetic surgeons versus plastic surgeons.
Sure.
So what's the difference in the training, education and all that?
Yeah, absolutely. So the thing that I ask patients to ask their provider if they're considering having surgery is, most of us do these type of procedures in our offices or in a surgical center, kind of setting. But I ask them to ask this question: if I wanted to, could you do my procedure at the hospital? And that tells me you have the appropriate training to do that procedure, right? Because the hospital does not give you privileges to do procedures for which you are not trained. However, as a licensed physician, there are no legal restrictions from you practicing outside your designated field, right? I mean, I can write for your diabetes medication. I don't, because I don't think I'm the best person to do that. But when you look at plastic surgery, cosmetic surgery, all of these terms, they're sort of interchangeable to the lay public, right? And it's hard to distill that down. So that's the best question to know whether your provider is appropriately trained in that procedure. In particular, so plastic surgery is kind of the traditional aesthetic surgery training route, right? I actually did an entire aesthetic fellowship. I did a year of nothing but cosmetic surgery, in addition to my full plastic surgery training. So plastic surgery to me is that plastic and reconstructive surgery training. And that means from head to toe, I'm qualified to operate on you, okay? Now there's facial plastic surgeons, right? So those are otolaryngologists or ENT who've done some additional training in facial aesthetic surgery, and they ideally would operate from the collarbone up. Sometimes that's true and sometimes it's not true. There's oculoplastics, right? So those are ophthalmologists that have additional training in cosmetics of the periocular area. And then there's cosmetic surgeons. Very politically correct. So there's even an American Board of Cosmetic Surgery, which is not an actual ABMS board. It's just, I mean, it could be anything from a weekend course, an ER physician, you know, to you know, an oral surgeon that's done some additional training but isn't even actually an MD or a DO, but a dentist. So that's where things get really derailed, I think. Does that answer your question?
Yeah, that's good, yeah.
So are you a dermatologist also, or is that a different specialty?
Different.
Even though
And
you're
so there's some cross reactivity, right? So for instance, you know, I do a lot of skincare, right?
Right.
Dermatology also does skincare. You know, I actually do some reconstruction for facial skin cancers. Occasionally I have a melanoma tomorrow. So there's some cross-pollination of specialties. You know, the dermatologists don't do facelifts, right? That's kind of where theirs end. For me, I don't typically treat rosacea. I don't treat acne, you know, those kind of more specialized pieces of the skin. In terms of like eyelid surgery, right? It could be me, it could be an oculoplastic surgeon, it could be a facial plastic surgeon, all of whom are appropriately trained to do that surgery.
So I might have missed something because I'm a little late, but do you work for the polyclinic?
I do.
Okay, so you have an office here, or
So our office is, I actually have 6 partners, so there's 7 of us. And we have the top floor of the Nordstrom Tower.
okay.
So it's 1229 Madison, so it's
Oh,
just up the hill
Okay.
a bit.
Can you maybe comment about the little gift bags?
Oh yeah, so I just bought some, you know.
You know, just, is there scotch tape in there? I want to know.
That's 12 vials of Botox.
I'll tell you a funny story about scotch tape. The crazy, one of my, well, a lot of them, but one of my crazy LA stories. We're going to see this patient, me and my mentor, and she's interested in a facelift. And I'm like, okay, and we go in and I'm like, what does she want lifted, right? Then she takes her wig off, and she has her whole face taped up. Right, which sounds quite labor intensive. So that's a really good candidate for people often ask me, when do I need surgery? So she clearly is ready for surgery. In slightly less dramatic fashion, what I tell people is when it fits into your life is when you're ready for surgery. So when it's not a huge economic inconvenience, when it's not a huge inconvenience in terms of time off or downtime from friends and social events, and when it bothers you enough to go through surgery, that's the right time. It's not a particular age for every person is an individual. And so when you're looking and you don't like any pictures of yourself, or you're avoiding pictures with family and at special events, that's probably a time when we should talk about the options.
I like that answer. Ooh. Well, I wanted to, first of all, say it was fabulous to have you here, so thank you very much.
Thanks for having me.
And there are little party gift bags if you want to take on home with you. And have a grand holiday. I hope everyone has a little time for themselves and pamper their face. Yes.
We call Botox the gateway drug.